Hello, my name is Victor Vogel. I want to welcome you to Coffee with Vic. Today, if you've ever been to an emergency room or been in a situation where you've been in an emergency room, it can be a little scary sometimes. Uh, you're not sure what's going to happen. And of course, if you've been hurt or you're ill, you're not thinking at your highest level at that point in time. So there's a lot to think about in the emergency room. And what you need to do to be ready in case that happens. That's what we're going to cover next on Coffee with Vic. This is a journey through American healthcare. Talk about the emergency room. This was my emergency room.
Certified Stroke Center, Senior ER, and now Level 1 Trauma Center. I'm Lila Lazarus. When an emergency happens, St. Joe's Ann Arbor has you covered.
We have a specialized team of physicians, nurses, and trained trauma surgeons who are available at a moment's notice. When seconds count, we're saving lives.
From serious falls to life-threatening injuries, 1,200 patients a year.
It's good to be able to be here and make a difference.
Level 1 Trauma Care 24 hours a day at St. Joe's Ann Arbor. Learn more at stjoeshealth.org/trauma.
Now, this was the emergency room I went to. And I'm going to tell you, it was a great experience, but it wasn't the only emergency room. Right when I was picked up, I was in Brighton, Michigan. So I was delivered to the St. Joseph, Brighton, Michigan emergency room in a small hospital there. Not as well equipped as the one in Ann Arbor, obviously, but just as good. So before we go too much farther, I'd like to share something I think is important uh, when we really get down to it here. Um, it's really important in terms of understanding why I had the great experience I had. Now, let me just say to you this. Uh, in any organization you go to, whether it's fast food restaurant, a movie theater, department store, Amazon, it doesn't make any difference. So much of what you receive and the quality and what you expect, and even if you don't know what to expect, the quality you receive is really kind of dependent on the management and the leadership of that group. And that then goes back to how the organization's leadership and management have set their values and their mission. This is the mission statement for the Trinity Healthcare System that St. Joseph belongs to. It says, "We, Trinity Health, serve together in the spirit of the gospel." So it's a Christian based organization as a compassionate. Compassionate means they actually care about you and transforming, healing presence within our communities. In other words, when you're with them, they want you to feel like they're compassionate and transforming your healing because of their compassion and wanting you to get better. That's an outstanding mission statement. And I'm going to tell you right now, the folks at Trinity Healthcare delivered that in spades to me, both in the emergency room and later I will cover in the next section the actual hospital stay and surgical part, this surgery part of my stay in the hospital also. We'll do that all in one session next time. But that mission statement has to be born out of something that these people believe in, their core value system, something that really tough to understand today because we've been driven apart and our core values are being challenged in America. But these core values resonated in everything from the time I entered into the Brighton facility to the time I entered into the Ann Arbor emergency room. And here are the core values this hospital operates by. We honor the sacredness and dignity of every person. You're not just a number in there. You are a living, breathing entity that people care about. And every time they touch you, everything they did, it, it just resonated in how they talked to me, how they responded to me, etc. A commitment to those who are poor. We stand and serve those who are poor, especially those most vulnerable. This would be your senior citizen group, of which I fall into, but it could be anybody. It could be small children. It could be anybody that are vulnerable and they, they are uncertain about things. And so there's this need to make you feel comfortable that they don't worry about things. Don't worry about your finances. Don't worry about anything right now. Just know we're here to take care of you and to make you as comfortable as possible and to heal you as fast as possible. Justice. We foster right relationships to promote the common good, including sustainability of Earth. So these folks are interested in, you know, developing a relationship with you, not just treating you as a money patient, but and they're not there to try to upscale whatever you're supposed to get so that they make more money off of it. They're only interested in developing a relationship that is in your greatest good. Stewardship, they take care of not, you could tell in the facility when I came in, I could tell that things were modern, they were new, I had the latest and greatest equipment I needed to take care of me and monitor and make sure. They had schedules set up, they had regular routines and rounds. They managed themselves well. You could see that and how they interacted with each other and how they responded to a couple of emergencies that I heard go on outside my door. We are faithful to who we say we are, which means they adhere to what these core values are in this mission statement. Now, that's the important thing I wanted you to know. I really did want you to know that because I think that's critical for you to understand. And you will see, I don't know that every emergency room is like this, but I just know these people honor their word in that light. So when you go into an emergency room, it's kind of scary. When I first was wheeled into the Brighton emergency room, I didn't know what to expect. I'd never been in an emergency room in that situation as a patient before. I've taken people to emergency rooms, but I've never really been in as a patient like that. So the quality of treatment that you get really kind of depends on several things. By the way, as I walked in, everyone smiled at me. Everyone me. I mean, those smiles make the difference. It's not like, oh no, you're here. I got to take care of you now. I mean, you could tell it appeared, they wanted to make me feel warm and comfortable at that point in time. That's a fascinating thing to have. When you hurt like I do, you have no idea what's wrong with you and you're concerned about it. Okay, but even when you're conscious, okay, there are a lot of things you have to know you're going to have to do while you're in the emergency room, and the quality of your treatment you're going to get, it's really kind of a lot of it's dependent upon you. The quality is dependent upon the leadership and management of the facility. We just talked about that. The location and size of the facility, the trauma center, whether it's a trauma center or maybe it's not, like the Brighton emergency room is not a trauma center. So the bigger the facility, the more likely you are to have access to better equipment if you need it. That's exactly why I ended going up from Brighton to Ann Arbor. They did not have in the small town of Brighton the stuff I needed for my particular injury. Their core values and mission statements we just went over. The availability of quality staff In other words, are there a lot of people available there that are with that particular nursing skill or doctor skill or whatever? And that kind of depends on whether you're in a large city, a college town, or just a small town like Brighton is, 7,000 people in its city limits area. How busy the emergency room is at the time of your stay has a lot to do. This was a blizzard night that this happened to me, and I'm telling you right now, I could tell by the way I interacted with people. They took time with me, they made sure I was comfortable, but I could tell they were burdened. They were burdened with a lot of people who had fallen, a lot of other things that are going on in that area, more than usual, I would say, because of the weather situations. This was just right on the beginning of the primal or the vortex that came in, the big snow event, freezing event. And so even things like weather that can block them having the staffing they need or anything, these are all things that can affect how your treatment, how you're treated in an emergency room. So there were times where I knew doctors sat down on the chair, they talked to me, they told me what was going on, they told me what to expect. They were collecting information that they needed on me, and it was done in a very, we would say, a good bedside manner format. But there was also a time when a doctor came in and asked all the right questions, got all the right information they needed to get, checked everything they needed to check. But I could tell they didn't want to hang around and chat with me because they were so busy on the outside. So I simply said, hey, look, I can tell you're busy, Doc. You don't feel like you have to hang here. And he said, thanks. He appreciated that. And he went out and took care of the things that were going on out there. So, emergency rooms are hectic, and there are a lot of variables that affect them. And so, you as a patient, if you have the ability to relate using these same core values, these care and concern for the doctor and the nurses and the people who are trying to handle so many other situations in an emergency room environment, I think if you have that kind of positive attitude about them and care and concern about them that they do for you, your stay is going to be a lot better in the long run in the emergency room. Now, you have some accountability. There's some things you need to know that you need to take care of. Some of these things are before you even think about having an accident or being sick. And other things are things you need to be doing during that process. So let's cover some. I'm talking about my feelings in the emergency room. It was very satisfying. I didn't hurt. They knew how to give me the right medications, but I had to make decisions while I was in there. You need to take time to organize before your accident or illness, so that when it comes to that, you can make the decisions while you're not, totally coherent, or you're not as alert as you would normally be. So you need to understand your insurance coverage. And I mean, don't just understand your insurance coverage, or read it in the book. I mean, get on the line, call your insurance people and say, walk me through what would happen. Let's take a real life example. Say I broke my hip and I had to have a hip replacement surgery. How many days am I going to be hospital? How much money is that going to cost me under this plan? Is there a better plan that would suit me because I am financially not able to handle the other side? Do I want Medicare to be my primary carrier, or do I want my supplemental plan like I have Humana Advantage? Do I want that to be my primary insurance carrier? And what are the differences between those, and why are they important? And we'll go into some of those when we cover insurance, but you need to do this before you have to talk about it with folks. You don't want to be wondering about this while you're hurting. Trust me. there's nothing you can do about it then, so there's no sense about worrying about it anyway, was my attitude. But have all your ID with you. Carry your Medicare card. Carry your Humana card coverage with you so that you don't have to fumble around. They can take it out of your pocket, take it out of your wallet, and go do whatever they need to do to get it going for you so you don't have to worry about that side of it. But I will tell you right now, none of that was a barrier to people taking care of me. Their first objective in this St. Joseph emergency room was, let's get him in, let's get him stable, let's minimize his pain, and let's figure out what we need to do. Nobody ever once mentioned, can you pay for this? Do you have insurance? Anything like that, until they had me in there and had me stabilized. Make sure you take time in the emergency to enter your emergency information on your smartphone. If they need that information, you're not conscious, they can pull that up on the smartphone. And even in a lock screen format, they can pull that up if they know how to do it. And that information's on there, like my blood type and, who to call in case, no, like I was on a sidewalk, so they picked me up. If I hadn't been able to call my daughter-in-law, they may not have known I was going to the emergency room. They can get on and get that information off your smartphone. So take some time and put that in there, so all of that information is in there. Your insurance carrier, etc. Understand how to use your phone if you happen to. I mean, in this case, all I had to do was push the side buttons simultaneously 3 times, and it called 911 immediately. And so consequently, I had my headsets on. I could just simply say, I've fallen. I think I've broken something. Here's where I am. And just stay on the line, and they'll find you through GPS. Now, if you're conscious, I will tell you this. If you if you are just not screaming with pain and you're conscious, if you treat everyone from the first responders and people trying to help you in the emergency room, through the hospital, all the way down to your people like physical therapists for home visits, courteously and with respect, you're going to find them respond in kind much, much easier than if you try to be grumpy. In other words, don't be a bad patient. Be a really good patient. Be understanding of their needs too. They have a lot of people that they're taking care of at the same time. You're not just the only one, but you will feel like you're the only one if you develop a rapport, if you develop a caring concern for them and their job. I found out about people. I found out about their history, where they're from and what they're doing, where they came from, and what they cared about and those kinds of things. And it made life so much easier in the emergency room as well as the hospital. I actually took time to do that while I was in pain. Okay, it's your call. If you're conscious, you'll be the one to accept or reject whatever the medical professionals are requesting. They're not going to push stuff on you. They're going to recommend it. And, I was really adamant about not trying to put any drugs in my body, any narcotics in my body that I didn't have to. So I was sort of at first rejecting morphine as a painkiller. I didn't know much about it, never had it in my system before. Didn't appeal to me whatsoever. Now, as the night wore on, after an hour or two, I was so very uncomfortable because I couldn't move, and it was so sore, and I couldn't do anything. I couldn't move any way because of the bone being broken that I could get comfortable. So finally, I paid attention to what they told me, and they administered morphine. And I'll tell you, within minutes, I felt so much better and more comfortable. So, they're going to ask you. They're not just going to automatically do something. So you have to have in your mind how you think you might handle this. Are you going to accept their information? And if you're really just a skeptical person, you're, and I was a little skeptical initially, but I tell you, I wasn't after it was all over with. I really wasn't. So I learned to accept them as professionals and who they were, let them do their job, let them adhere to those core values that they were talking about. Now, this is something I hadn't done, and I've now thought about since. I've got to get with my family, decide what I want to do, but get a critical life and death decisions memorialized in a living will, so you take the pressure off your loved ones. If I'd happened to hit my head and gone into a coma or something like that, it would have been a lot of pressure on my son or my daughter to make a decision about what to do with me. You need to let them know what you want to have happen, and you need to get it memorialized legally in a will, and then the copies of that need to be where people can see them. And if you need to, change it periodically, you need to do that also. All these things are things that would be really cool if you take my advice from somebody who didn't do a lot of these things. I did have some of the information on my phone. I did know how to use my phone and stuff like that. But this other things, these are important things for you to remember just from this video that can help you if something ever happens to you in the future. If you want to join me on sessions like this in the future, you can go to facebook.com, Coffee with Vic, go to my events page, and the sessions that I conduct on Coffee with Vic will be there. And we need to spell Vic right. But anyway, I'll do that next time. These shows are really just designed to be helpful little shows to talk about things you talk about over coffee. I have a topic I'll be covering. You're welcome to go to that Facebook page. Send me a message from there. If you want to be a guest on the show, where you're live on air with me and we can talk about the topic that I'm going to be covering, or if you have a particular topic you like to talk about, and we can schedule a show for you, or maybe for you and 2 or 3 or 4 other members of your coffee group, you can reach me and get there. What I wanted you to know about my emergency room visits is that a lot depends on how you are treated in those situations. A lot depends on you as a patient, so you have some accountability. So try to be nice, try to be respectful, try to understand what an emergency room environment is and it's like. It's not like just being in a hospital. There are a lot of other activities, a lot of other people going on right there. So the next time, we're going to actually cover my hospital stay. We're also going to talk a little bit about the surgery that I had. And I'm not going to go in detail, so it's not going to get gory, but those same core values that I brought to you a little bit earlier permeated my whole stay through that hospital. From the time I got into the emergency room in Brighton to the time I walked out that door and was on my way home, and then in my home visits, which we'll cover as part of the segment after the hospital. Okay, so this is Coffee with Vic. That was my emergency room treatment. Those are my emergency room advice. Based on my experience, I tell you what, it made things a lot easier for my life. Now, because of where I was, the people that treated me the way they did. And now I know I've got a lot of things that I'm putting together in case something ever happens to me again, that can be there. Okay? You have a great day. Until next time, I hope you enjoy your coffee. See you later.